then it is called single energy concept. The same energy, if it is addressed by the dual macronutrients, carbohydrate and fat, then it is called dual concept. Let us see if you address the energy expenditure of an individual only with carbohydrates, they will tend to have a hyperglycemia. So that hyperglycemia will impair the immunity. The glucose is metabolized into two major components. One is carbon dioxide and another one is water. So if you give more and more glucose to your patients, the patient tend to have more of carbon dioxide and more of water. The more carbon dioxide production will lead to respiratory distress, increased sympathetic activity and metabolic stress, and more water production will lead to water retention. So by giving more and more of glucose to our patients, they tend to have a high carbon dioxide for which they have to work respiratorily more, and they have a water retention at the end. If you give glucose alone without addressing the phosphate deficiency, the hypophosphatemia can happen. That can aggravate the glucose metabolism, or otherwise by giving them the more and more of glucose, they tend to have a hypophosphatemia, and that reduces tissue oxygenation. The oxygen dissociation curve tend to go to the left side and the tissue will go for a hypoxemia. And if you address only carbohydrates, not the fat, that only can lead to the fatty liver. The carbohydrate metabolism will lead to lipogenesis in the liver, and the liver will go for fatty liver changes. And essential fatty acids, if it's not given, they will have a poor wound healing. So carbohydrate as a sole energy, if you are giving continuously to your patients, you will have all the problems. If suppose we are addressing the energy expenditure with the carbohydrates and adding the fat, either IV form or through the enteral route, let us see what are the benefits which we can see on them. Decreasing respiratory stress, it improves the nitrogen utility, and actually the protein sparing effect, optimal resistance to infection, decreased water retention, and it indirectly enables as a partial parental nutrition. And remember, it prevents or reverses the fatty liver. The fatty liver changes are due to the carbohydrates and not due to the fat what you are taking. So if you are giving them the fat in addition to the carbohydrates, we can actually